All right, everybody. Welcome to this town hall about health and safety guidelines for adult sports organizations. We're going to get everyone a minute to join us and be part of what we're about. I know a bunch of you guys are waiting to join, but so just come on in and welcome to the conversation. We've got a great hour planned for you with some great experts and panelists and perspectives. My name is Jeremy Gilbert. I'm the president and quarterback at LeagueApps. Normally, I would say that I was only a quarterback in the 7th and 8th grade, but I also was a quarterback when I played adult sports for many years in my 20s, multiple championships to show from it. And it's not bragging in the context of today's conversation to talk experiences there. And what it did is gave me such a unique perspective on the important role that adult and social sports plays in this country. And as we think about coming out of this pandemic, as we navigate being in this pandemic, one of the things I think people are craving is the opportunity for community, the opportunity for physical activity, and ultimately, I think you all offer so much of that. And at the same time, it's so important to think about how to do that safely and securely, and doing that with the best interests of the participants in your program and the communities in mind. So that's really what today's conversation is about. And one thing that we've felt as LeagueApps has gone through the past few months is that no one has the answers, which means everybody has the answers. That the community is where you've got to go to understand best practices and approaches. And if we can learn from each other and support each other, that's ultimately how sports leads this comeback. One thing that I'm happy to say is that today's session is done in partnership with the SSIA, and they've obviously done such a great job bringing the industry together. I appreciate how hard their job is as someone who's tried to pull together a coalition that's advocating in Washington that the SSIA is part of, seeing the great work that Chrissy and Brian are doing. And one of the things I believe is that what an association like the SSIA represents is what happens when you bring people together and the kind of collaboration and communication that's possible. And again, that's the spirit of today's conversation. So thanks for them being part of this. And I'm also excited to have the Hospital for Special Surgery here, HSS, and expert Dr. Toresdahl. We'll get into that conversation in a second because what HSS has done is lead the way when it comes to sports medicine, and they've been an amazing resource to the sports community over the past few months. As we approach the conversation today, I'm reminded of the famous John Wooden that once said, the UCLA coach, it's what you learn after you know it all that counts. And the people that I'm speaking to, the people that are on this conversation and listening in, know a lot about running their organizations. But there's so much more to learn about navigating COVID and ultimately how to use this period of pause to be even better as they return to play. So that's the spirit that we'll have conversation. I want to make this more of a dialogue, so you'll see a Q&A tab on the right-hand side of your Zoom window. So feel free to click that Q&A tab and ask a question. And when you do, anyone else can read that and then upvote that, so it helps me understand some of the questions that are most important to this community. And with that, I'm excited to welcome in Dr. Brett Toresdahl. He is a doctor who is an assistant attending physician at the Hospital for Special Surgery, HSS as I'll refer to it. He's also the research director for the HSS Primary Sports Medicine Service. And one of the perspectives that Dr. Toresdahl brings to the conversation is being the team physician for US Biathlon, for Rugby United, as well as an orthopedic consultant for UFC, and also experience even in professional tennis. He was a physician at 2 Olympic Games. And brings lots of different experiences working as team physicians for a countless number of different professional sports teams. So Dr. Toresdahl, thank you for joining us and for being here today and for speaking to this audience of adult sports leaders across the country.
Thanks, Jeremy. Appreciate you putting this on.
For sure. So there's a lot of questions that I think this group has, and again, they might add some as we go. But one of the things that all these organizations are contending with is how they're thinking about running their kinds of programs in a way that's safe. And in the coming weeks and months, when there's so much uncertainty around it, how would you start off with some advice for these organizations, the way that they think about opening up and returning to play and doing that safely when there's so much information out there that they're trying to distill into practical requirements and programs and suggestions for the way that they operate their programs?
Yeah. Well, in a time like this with a pandemic, there's nothing that we can really do in terms of life outside of our homes or apartments that's 100% safe, that would guarantee that we're not going to catch or spread coronavirus. But it doesn't mean we can't start to safely reemerge into some of the activities that are so important in terms of just our overall well-being. So I'm guessing if you're tuning into this, you probably already understand the importance of physical and mental health that sports bring to our lives. So with that, there's things that we can be doing and starting to begin exploring with sports, organized sports in a safe way. And it just takes a lot of thought going into it to figure out the right environment, the right timing, the right precautions so that you can do that in the safest way possible.
And can you elaborate a little bit more when you talk about the thought and kind of preparation that goes into it? What are some of the core elements that organizations really need to be considering as they're designing and executing kind of their return to play programs?
Yeah, so unfortunately, there's not a magic formula. So you could enter in the rate of transmission of COVID in your community, plus the number of athletes that are going to be participating, plus some factor of indoor versus outdoor. And then you magically get this number that says that it's safe to conduct your event. But you can start to just gather all that information and think through it. So first of all, what's the rate of transmission of COVID in your community? So for a while in March in New York City, where I'm at, you probably wouldn't want to be playing softball or anything, even outside where there's not a lot of contact. Just everybody was indoors or doing individual activities of going for a run or a bike ride. And even then it was a bit anxiety provoking to pass somebody on a running trail. But now that we're in a place where the spread of it is starting to decrease, at least in New York, not necessarily the case in all across the country, we can start to look at what are these other things that are important to consider when deciding if we can host an event, big or small. So first of all, rate of community transmission of coronavirus is important. Then we think about, is it indoors, outdoors? At this point, it seems like the spread of coronavirus outdoors is pretty small, especially when you can be socially distanced. Is it a contact or non-contact sport? You have to think about if there's shared equipment. Is it an activity that you can be socially distanced? Can you wear a mask when you're participating? Is there a way to screen athletes as they check in to get to the event with checking their temperature, asking them about symptoms? And is there a way that we can try to encourage folks with high risk, who are at high risk of having a severe illness from COVID? Like if they're older, if their age is 65 or older, if they have other comorbidities or other medical problems, or maybe they're healthy, but they live at home with a grandparent who has those things. So just making sure that participants are educated about if it's just safe for them to participate as a group and then as an individual.
To unpack a few things that you said. So first is, as you think about the type of sports that are being played and the way that those sports are being played, how do you think about the idea of social distancing in sport, and what are some of the kind of best practices or considerations that organizations out there should consider?
For a lot of team sports, there's going to be some interaction, even if it's not a contact sport. Imagine with baseball or softball, you're going to be in proximity to the catcher, to the first baseman if you're a runner. There's some of that that's just innate in the game that you would have to do some major rule changes to prevent that sort of proximity to other players. But there are things that are in your control. So you don't necessarily need to line up everybody in a dugout side by side. You could figure out ways that you could have some spacing there, or maybe not be possible to always wear a mask when you're playing, just in terms of being able to give a full effort. If you're running or sprinting and you're wearing a mask, that doesn't work so well. But if you are playing a position where you may not have to sprint, like a catcher, or you're on the bench, that's a time where you could put a mask on and potentially be able to prevent that spread to your teammates.
And maybe just elaborate that a little bit in terms of the way that these adult organizations should think about the use of masks, and in terms of playing and being on the sidelines. What are some ways that they might think about some of those best practices as you start to get into?
Right now, I think it's best to err on the side of wearing a mask whenever possible. And then if really just logistically it's not going to be possible to wear a mask, make sure that it's in a place where there is an ability to socially distance. And then if you're in a situation where you're going to be in close proximity, it's not feasible to wear a mask, then you have to really think about the overall risk of how much COVID is going around your community, and how reliable can we be with screening with symptoms and temperature checks as you're checking in. And then just adjusting based on overall risk and comfort of the participants, knowing that, like I said, nothing is perfectly safe in the context of a pandemic.
Do you, one of the things, like a question that just came in is around the questions of masks. It seems like the CDC was suggesting perhaps not wearing masks during strenuous activity. Does that create risk in terms of, if you're doing strenuous activity and you have a mask on, what are the risks associated with having the mask on in that case versus off?
Wearing a mask when you're exercising, in terms of just general health, there's not a risk that you're going to injure yourself, you're going to injure your heart or lungs. It's just that your exercise capacity is going to be less. So you're not going to be able to exercise as intense or for as long if you're just unable to effectively breathe oxygen in, get carbon dioxide breathed out.
So in that scenario, it's one of those things where there's not a health risk necessarily posed to wearing the mask, but it just may be a performance-related risk that may also be influenced by the type of sport.
At this point, that's the general understanding in terms of masks with sports, but it's not something that there's much history or experience with so far, so a bit of that is just expert opinion.
Right. Knowing in working with so many variety of different professional sports teams and professional sports entities, I think one of the things that's tough is as organizations consider, the state and local issue area they're at, the guidelines that might exist coming out of sports and governing bodies, the information that's coming out from the CDC and others. It's like, how do you integrate all this stuff? So what are the ways that you've thought about developing and synthesizing information as you've presented or provided recommendations, some of the teams that you work with, and maybe that provides some guidance for how organizations think about prioritizing and integrating all the information that's out there right now?
Yeah. So right now, a lot of the competitions have been canceled for the teams that I work with. So the conversations we're having is more about how can we effectively train during this time. And there's lots of advantages to training in a group setting. There's the interpersonal aspect of just encouraging one another, learning from one another, the benefits of social interaction. But at the end of the day, it sometimes is possible to achieve those same training goals individually. And if you can do that while allowing everyone to feel comfortable, to feel safe, and to reduce that risk of transmission, since there is that possibility that people can be asymptomatic and still transmit the virus, that's become more or less the default at this point. There's going to be, as testing becomes more available, hopefully we can start to lower that threshold in terms of people feeling safe to participate. That's one of the things that is really important to think about, as whether it's in an adult recreational league sports or at a higher level, that it want to make sure that sports are fair for everybody to play. And if you're coming with different risk factors or different just general risk aversion in terms of being exposed to a potentially serious illness, you want to make sure that people feel comfortable participating if they want to, and comfortable opting out. So for some leagues, they may say, this is going to be a fun season. We're not going to award a trophy at the end or have a tournament or a championship, because we don't at any point want people to feel pressured to play for the sake of their team. That might influence people to downplay symptoms or not disclose concerns they have. And so you could get into a tough situation if somebody has a tournament or a championship and they start to have symptoms, but they feel like they'd be letting their teammates down by doing the right thing and sitting out. You want to make sure that people are in it for the right reasons and they feel comfortable participating and comfortable also sitting out.
Yeah, it's such a good point, because I think the adult social sports sector is probably uniquely positioned to handle this. I've seen on the youth level, for example, there's some tournaments that are running that have basically said, hey, in order to get people in, rather than have people advance and not know who's going to be around, you're basically coming in, you're going to play 2 games each day, and then you're going to leave, and there's not an ultimate champion, but you get a chance to play and experience that. And so, again, because so much about adult sports, even though competition is an aspect of it, the fact that people get to be with people they like and have fun and get physical activity and all the mental benefits that come with it may be sufficient, and then eliminate some of those pressures. So it's a great observation. One of the other questions has to do with the staff themselves, whether it's the staff that that's devising the training protocols for the professional organizations you work with, or the staff of the organizations themselves here. What is the specific advice and best practices when it comes to the way that they're protecting themselves and therefore protecting their participants, or other protocols around sanitizing and things along those lines?
Yeah, it's very similar to what the general guidelines are for people as they exist in communities, that you're being smart about where you're going, what you're touching, how you're washing your hands, that you're being consistent with wearing a mask, and not having unnecessary interactions. So as if something is possible to do in terms of a team meeting or a planning meeting, even if you may be 2 doors down the hall, you can sign onto a computer and keep that risk minimal. And then you just have a kind of a baseline understanding that this is how we do it. Unless there's a great reason that we have to meet in person, you opt for the lowest risk option.
A few final questions. So one is, as organizations are out there trying to kind of create these opportunities for adult participants, what they're facing is every adult organization or an adult individual that's considering participating is having to weigh, what are the risks of coronavirus versus the benefits of physical activity and getting out there. So do you have a sense of as they're trying to balance those considerations and also communicate the value proposition of being able to play sports again, how do you articulate and balance the benefit of actually getting out there and playing versus the potential risk that is associated with the disease itself?
Yeah, and I think a lot of people are starting to feel that their individual risk of the illness may not be great. They could be young and otherwise healthy and not be in that high risk category. So they may feel a little bit invincible when they're out there and they can be comfortable in that setting, but it doesn't mean that they're not going to transmit it to somebody else who's at risk of being hospitalized or dying from the infection. So you have to think more from a community perspective and not just an individual perspective. Beyond that, it's something that we have to also think about, what's the end goal. So is the end goal to socialize and keep people exercising, keep people healthy? And if you can do that safely in an outdoor setting, or being able to do it with masks and socially distance, where you're really doing all of the things possible to minimize that risk, then that's great to be able to combine that all into one event where you can have that social interaction and positive mental health aspect of it and physical health aspect of it. But if it's really going to create a lot of strain or burden on resources with cleaning and protocols, and people are going to maybe not feel comfortable because you can't socially distance, then maybe you can encourage people to have social gatherings virtually and encourage them to exercise individually. So you could still keep people active, keep people social in other ways, potentially facilitated by that through some team competitions of who can log the most runs on some app, or play a trivia night as a tournament rather than a sporting event. So still engaging them as a group, socially, physically, but maybe not all combined as one.
Final question that's coming in a few different ways. If you're an organization and there's a participant in your program that indicates that they tested positive, what should you do? What are the appropriate ways of protocols in terms of communicating that out, whether it's from a government perspective or to the other participants in the league, and the best protocols around it?
Yeah. For a lot of people who have COVID, there's not that necessarily a stigma with it, although in certain circumstances there may be. So it would be worthwhile having a conversation with that athlete if they feel comfortable letting other people know that they tested positive and that they have the illness, because that's something that's potentially private health information that you don't want to necessarily transmit out to the broader team or the league without their permission. So a lot of people know that this is something that can be contacted. You can get infected, not because you did anything wrong, but just because of some bad luck as you're at the grocery store or something else. So if the athlete who tests positive is comfortable, I think that's the best situation, so that people can be supportive of that athlete, check in on that athlete, make sure that they kind of feel included in terms of team dynamics. But then going forward, it's also important that they know that if there's been close contact with that athlete, that people are aware to quarantine, to monitor for symptoms, to check in with their primary care provider. So if it's a team where it's unable to be socially distanced and they can't do masks. So there is that sustained close contact with somebody who was recently tested positive. Those people could become symptomatic or may have the infection without having symptoms. So they need to take on extra precautions in terms of their exposure, what they're doing in terms of their activities, how they're going about their day, getting groceries. So it is something that it's important to know that currently there are still quarantine recommendations that if you've been in close sustained contact with somebody who has COVID, test positive for COVID, that you need to take on those extra precautions yourself for a 2-week period. So
right.
When people are beginning to come back into sports, they need to also know that that's a possibility, that as part of their willingness to participate, they also have to be willing to go along with the recommendations should one of their teammates or somebody they compete against test positive.
And from a close contact perspective, that might consist of people on their team and potentially the team that they played against based on the sustained contact. So if someone played on the field later that night, that's not necessarily wouldn't be sustained contact, but sustained contact would be someone that maybe they played with and potentially against. Is that depending on the sport?
Exactly, yeah. So in an outdoor setting, I think that's where you could potentially not have that close sustained contact, where if you're on another team, if you're not sitting side by side on the bench together, it's not that that person has now exposed everybody in the field. But if you're playing basketball where you're coming into contact with one another, defending one another in really close contact multiple times over in the course of a game, that's a condition where you want to make sure that you're notifying everybody who is involved, who had contact with that player.
Awesome. And final question, Dr. Toresdahl, is you obviously a sport medicine doctor. You see all kinds of injuries. So all of a sudden you have people that haven't been as active now coming out in the fields, getting active again. And let's hope that it's not about the COVID stuff, but it's more just about the kind of injuries you see. Any best practices these organizations to make sure that the people in their program are minimizing the risk of injuries as they come out of this layoff?
I think we're seeing a lot of muscle and tendon injuries, at least in my practice. That's what people are coming in with, who have been they've just been thrown out of their normal exercise routine, and then they're starting to get back into whether it's recreational sports or individual exercise. People are just becoming a bit deconditioned in a way, and so they're not as adaptable or resilient to the type of stress that their minds are used to putting on their body. So it's important that if you are starting up a league, that you could encourage participants to maybe provide them with somewhat of a preseason training plan, or encourage them to get out there and do some drills, just so that on the first game of the season that that's not their first time outside their home exercising in 4 months.
Yeah, good stuff. Well, Dr. Toresdahl, I know you're seeing patients, and I appreciate all the time and effort for trying to focus on this for the sports community, and certainly for communicating here today. So thank you for being with us and sharing those insights. And if there are follow-up questions that people want to continue to post here or in the industry Slack group that LeagueApps has set up, we're happy to follow up with HSS and Dr. Toresdahl as well. So thanks again for being with us, and I'll welcome in our other panelists as we let you go.
All right.
Thanks again, Doctor. And we'll welcome to the conversation Nate Baldwin and Katy Wade and Tarek Pertew to the conversation. Katy Wade is an event expert with Kansas City Crew. She actually was a participant in the league, now works for the league, and the incredible work that they're doing in Kansas City for adult sports leagues and special events. I think, as I understand it, you were actually a former X-ray technician as well. So you were in the medical field before you came into the world of adult social sports. Nate Baldwin was a programmer for the city of Appleton Parks and Recreation Department for over 6 years, and he really helped lead the revitalization of the department's youth sports program. And he's got all kinds of experience working in different kinds of organizations, whether it's Appleton Parks and Recs, or Red Bull Nation, or Western Alternative Sports Association, or the Highlands Ranch Community Association. So welcome, Nate, to the show. And last but not least, we've got Tarek. And Tarek is the co-founder of NYC Footy. I've known Tarek for years. He was one of LeagueApps' first customers. He's also the chief creative officer at Uncubed, which is an unbelievable platform that connects innovative companies through online learning, editorial, and events. And I've gotten all kinds of event advice from him over the years, and always appreciate all the work that he's doing with the thousands of people in his organization. So thank you, team, for joining us.
Thanks for the great intros, Jeremy. Seriously, much appreciated.
Great to be
Sounds
here.
good. So Katy, I'll start with you, which is, I guess you managed to open up with programming more recently in Kansas City with the crew, and so I'm curious to know how, as you listen to Dr. Toresdahl talk about kind of all the different considerations, how you have developed kind of a return to play plan and the way that you're approaching kind of balancing all the safety and the fact that people want to get out and play again.
Yeah, so thank you for having me on the panel today. So we are working very closely with the mayor of Kansas City to conduct our plan and make sure that we have everything covered. We're taking the right steps. We're doing all the things that we need to do that's mandated by the city. We've done lots of things. We've posted our plan on our website. We've sent it out to all of our leagues. So if at any point anyone is curious to what the plan is, we can send them directly to our website and say, here it is, list it out. And like I said, we did send it out to them before the leagues started.
And maybe elaborate a little bit more,
yeah.
Which is when you think about the kind of ways you've had to adapt kind of the protocols around safety and health and sanitation or programming, what are some of the biggest changes and the adjustments that you've had to pursue?
Yeah, so we weren't able to bring back all of our sports. So like the main one that we didn't bring back for our current summer season is basketball. Since it is, the most contact sport that we do offer. We are offering sand volleyball, kickball, softball, pickleball, and cornhole. So for the most part, those are, social distancing can still happen. The biggest change for kickball and softball is that there's no use of the dugouts. So people are encouraged to bring their own chairs. We have the dugouts closed off. People can sit along the fence at softball and along the sideline for kickball for their whole teams. For volleyball, we have an entire staging area. So we control 6 sand volleyball courts on our riverfront. And typically everyone, when they would arrive, they would just go to the courts. Well, now they have to check in quite a ways away from where the courts are. And we have staging areas. So everyone gets sanitized when they arrive. They check in with our monitor. And then we actually send them to a staging area with their other teammates. And then once the previous time is completed, they have to clear the courts. We then have another staff person who goes and sanitizes all the balls, all of the nets, all of the paddings. And then once that's done, then those people who are waiting in the staging areas can then go to the courts. And then, like I said, as soon as the games are over, everyone has to clear away. And then the other thing, cornhole, we have, I don't know if anyone's seen the ACL tournament. I think they had it on ESPN probably, where there's an actual staging area. So if you're not throwing cornhole, or if it's not your turn to throw, you're stepping away 6 feet away. And then when it is your turn, you're coming back. And then our staff, big change there. We do have a sanitation person at all of our leagues. So normally where we would have one person running the leagues themselves, we now have a second person who is there to check everyone in and sanitize upon arrival. And then our staff has to wear a mask, both reffing and the sanitation person, and gloves when necessary.
Final question, and I'll pull everyone else in, is in terms of any kind of attestation, where when you talk about the monitor, are you asking people to self-certify against symptoms or temperature checks, or how are you handling that?
Yeah, so we aren't doing any temperature checks on site, but if anyone has any symptoms or has tested positive, we're asking them to notify us. I'm learning that that's not necessary, or that they don't have to disclose that information. I am a part of the SSIA, and someone let us know that yesterday, that players don't have to notify us. It should be the physician or whoever diagnoses them. But we are asking, and we did have someone contact us yesterday and let us know that they tested positive since playing in the leagues last week. But if anyone's showing symptoms or has tested positive, we're asking them not to come to the leagues.
So we'll follow up on that. I'm sure there'll be lots of questions. I'll pull Tarek into the conversation. And Tarek, obviously, Kansas City is one thing, in New York, where we know NYC Footy is based, was at the kind of epicenter of the pandemic at the starting point of this, and is probably in a different phase as the return to play. How is NYC Footy thinking and preparing for opening back up? Have you done that yet? And as if you haven't, what are the ways that you're putting into place protocols to do that safely?
Yeah, so we made a decision early on that we were going to peg every decision that we made against what was coming out of the local and state government, whether we agreed with them or not. And in many cases, I've not agreed with a number of the things that they've done. But the best way for us to be predictable to our community was just to say, whatever you hear, that's what we're doing. And so we've been following the phased approach. For the most part, we've just gotten recent word that we are likely going to take the field again on September 1st. A lot of people are disappointed by that. A lot of people love the fact that there's actually a date out there. And the way that news came to us was basically the Parks Department notified anybody that's ever basically had a permit that they are now accepting permits for fall, which starts September 1st. Even though they don't know, they have not been given the absolute go-ahead, they are anticipating they'll get it. And then the local, kind of our main field, which is the Brooklyn Bridge Park field, we just got an email this morning saying the exact same thing. Like, hey, we're going to try to get everybody back out here in September. You can go ahead and apply to fall. So we've notified our league, and that's like as far as we go. So we'll say, hey, we've just gotten word that that renewals are available, which means that you can probably expect that the league will open in September. What we're going to be doing is, once New York City hits phase 3, which is supposed to be Monday coming up, then we're going to actually open up registration for fall, because that would mean that we have hit phase 1, 2, and 3 on time. And so the expectations will hit phase 4 on time. We are currently categorized as a phase 4 activity. Now, phase 4, that would mean that phase 4 would go into effect before the end of July, which would give us presumably 5 weeks to actually, as a buffer even then, to get started. So what we're going to do is we're going to open up registration. We are then going to go ahead on that same period of time. We've got like a list of people that we're going to refund. And we made a decision that we'd refund anybody that moved out of the city or lost their job. Everybody else would get a credit and then some. That was kind of what we decided we would do. So then we're going to move everybody's credits into the system, into LeagueApps, so that they can then register for fall, presumably for free, or even have some credits left over. This is what's been communicated to everybody. We've had some people respond and ask, we also have a tournament on Governor's Island on September 19th. And we've had a lot of people asking, like, what measures are you going to take? And I've been 100% honest and says, I'm not even going to try to tell you what measures we're going to take now, because come September, invariably it's going to change. Invariably. To me, it's like an exercise in futility to tell everybody what we'll do. I just said, rest assured, we're going to take whatever precautions that at that time are the safest for our community. If it means that we're going to have gigantic hand sanitizer stations, we're going to have them. If it means that we're not going to share water out of a water fountain, we're going to have unfortunately, single-use plastics are through the moon right now, but single-use plastic bottles of water that everybody can have for themselves. Where obviously, as Katy was saying, the main goal is not necessarily to keep people from interacting with each other physically on the field, is to keep people from interacting with each other when they're not on the field. Do I think that's still going to be in place in September? Yes, I do. And so I think we're ultimately going to have to put things in place that will align with, again, what's coming out of the government bodies. One thing that we haven't decided yet is how our champion's going to celebrate. We always do like a trophy celebration. We actually have champagne. We have a photographer. It's a kind of an intimate experience. We have to rethink that. I think, with sport, it sucks to not be able to celebrate. I'm a big Liverpool fan. So Liverpool just won the first title in 30 years. And like, every Liverpool fan's being like, it's not that deflating that we can't celebrate. It's like, it's deflating. Believe me. It sucks that you can't celebrate, but that's just the reality. And we have to rethink with our own leagues what celebration looks like. That's a super long-winded answer. Hopefully it's helpful to people, but generally to really summarize, it's that we are communicating only as much as we've been communicated. We're not going to even attempt to step out and do anything.
Well, just a quick follow-up question. Have you built return to play protocols and plans? So even if you haven't launched it, is that stuff that's going to be developed as you get closer to that guideline, or have you already made some decisions about specific kinds of equipment or protocols or different kinds of formed or modified form of plays, or is that to come?
We only have what if scenarios. So for instance, we might drop our leagues to reduced minimums, right? So right now we are mostly a 7v7 league, short field soccer league. We might reduce it to 5v5 as an example. We obviously have thought about what sideline rules are going to be put into place. There will no longer be gatherings on certain sidelines, so we're going to have to put certain precautions in place with respect to that. So it's the way that NYC Footy plays as an adult recreational league. There's not fans, there's not supporters that really come out. It's really just a gathering of players all in one area, and then on the sidelines when they're subbing, those are the majority of the rules that we're focused on. In addition to creating sanitation measures, by bringing sanitizer and cleaning the ball and what have you.
Gotcha. Nate, I'll bring you into the conversation, and you bring a couple different perspectives here. One is getting a sense of how the parks and rec departments are approaching this, because so many of organizations out there are dependent on that as having the space to play. And then also more generally, as you see any of the number of organizations you've been involved with, as they're thinking about returning to play, and I don't know what the state of Wisconsin's been, but ultimately how are organizations thinking about doing that safely?
Yeah, so I can speak to the park and rec sense from a Eastern Wisconsin perspective, and that is we've been relatively fortunate in that we haven't borne out the numbers of COVID cases here that other states are experiencing. However, we're if you look at our infection map, we're still red, and things are still increasing quite rapidly. So it's on everyone's mind. It's on the mind of all park and rec districts. It's on the mind of every organization trying to do business in this area. And since I've been in both the adult sports arena, but also the youth sports arena, it's been an interesting dynamic to watch in that the park systems around here have actually been far more lenient in terms of returning to play for adult programs than they have been for youth. For the most part, very few youth organizations have returned to play, but if an adult program can put together a viable return to play plan with the protocols that both Katy and Tarek have described for their own organizations, for the most part, those plans are being approved, and a lot of those organizations are returning to play. Now, understand it's a much modified version of what they would normally do. But it's a plan that has been shaped and approved by local public health departments, approved by the Park and Rec, permit has been approved. They're out there, they're playing. And so I think that's a good thing. And it's good that people have had that outlet. I think, as we all know, kind of speaking to your second question, this industry was born out of creativity and trying to capture a sense of community. That's the real value for participation as an adult in these types of programs. This becomes your tribe. And so people are really missing that. And I think that anything we can do as organizations creatively to just recapture, even if it's not perfect, just to try to recapture some of that sense of community. Katy described a couple of really great programs that they're doing that satisfy the need for social distance, satisfy the mask requirement in some cases. Those are great. I ran a adult sports organization in Denver, Colorado for 10 years. And at first I was tempted to think, well, this is about the sport. And after 10 years, what I realized is it was never about the sport. The sport was the excuse to be out there with your friends and being a part of a community. And that was what attracted people to the program. And I think that's what, just as a collective industry, we need to keep in mind too, is that first and foremost, people are missing their sense of community. And if there are creative things, even if it's just doing one-off events rather than a full-blown league, if it's activities we never would have considered offering as an event or a league, maybe now is the time. Now is the time where creativity and transparency are going to be critically important, not just to the success of the program, but in some cases, the survival of the program.
When people are trying to interface with park and rec departments to get access to space, any advice or tips about how these organizations are thinking about it? Also, the fact of the matter is a lot of these municipalities, their budgets are being cut pretty substantially. And if that hasn't happened, it's going to happen, just based on some trends we see across the country. So what's the best advice you have about how people are getting access to that space and, providing the information necessary to be able to return to play?
Yeah, well, I'll kind of work backward from your question. the first point is, I think the budget cuts actually work in most organizations' favor. This is one of the rare sources of revenue for a park and recreation district, or for a municipality in general. Other than parking tickets and field rentals, there aren't a whole lot of revenue generators within a city government. So this is actually a real opportunity to make the case that, hey, we can, if we can help fill these spaces, if we can bring the people, we can help overcome some of those revenue challenges you're going to see over the next year. I think that's a very strong argument. With the last downturn and recession, 2008, a lot of park and recreation districts completely abandoned their programming altogether and outsourced it completely, making that argument that we stand to make more in revenue off of a outside organization doing what they do really well if we were to try to do this ourselves. And so a lot of park and rec districts made that transition 12 years ago. I think we're going to see a trend towards that again as those budget cuts come. Maybe not in the second half of 2020, but certainly in the first half of 2021. And so organizations that are on top of their game and can capitalize on that argument, I think they're going to be in a real good position to acquire the space they need. The first part of your question, which I'll answer now, I think there's also park and recs have the tendency to think very traditionally and uncreatively, I'll say. And so I would think about playing spaces. My advice to organizations would be, think about playing spaces in an organic way. Kickball is a really good example. I think there's a tendency for many of us to think that kickball needs to be played on a baseball diamond or a softball diamond. Well, that's not necessarily the case. Really, all you need is a patch of grass. So I think there's a need as we emerge from this to think creatively about the playing spaces we use and how we can maximize those spaces. Not only will that be good for providing you with options as a programmer, it's also going to provide you with efficiency in the way you spend and in the way you manage your own costs. So those are just a couple of thoughts on both of those topics.
That's great. Katy, one thing that there's a lot of energy, you see this in the Q&A tab, around how you deal with the positive case. You mentioned this just happened to your organization. Certainly wish the person involved well. What was the protocols that you all had in place in terms of who's getting notified and teams getting quarantined? What's the dynamic there?
Yeah, so we went back and forth quite a bit on this. And what we're doing is we're notifying the team that they played against. It was a sand volleyball league. Everyone's pretty confined to their court. So we're notifying the team who they played against and just letting them know. At this point, we don't have to shut down leagues. And so that's the stance we're going to take, unless it becomes a bigger issue or unless we're hearing about more people testing positive or showing symptoms. We're not going to close down any leagues at this time. We're just requiring that the person on that team or that whole team to take a break, quarantine themselves. So not the entire league.
And so you basically notified the team that they're on, the team that they played against, and then you're basically saying for the team that they're on, you're going to take a break from playing. For the team that they played against, are you requiring them to take a forced break as well, or you're not requiring them to do that?
Not at this time. Yeah.
And one of the questions, and maybe it sparks a broader question, which is as people are investing and coming back, are you having to think about refund policy differently and how you're structuring payments differently? Because there may be these kinds of interruptions that happen for that team in question or for a particular player in question, whatever else. At the same time, people obviously know more about what's going on when they come into this, which wasn't the truth in the spring season. So how are you handling that as an issue?
Sure. I can't speak for everyone, but what we're doing is we will we're not doing any refunds. But if someone says it's early on, I'm just going to take the rest of the season off, we're transferring their registration to the following season. So like our fall season, we're planning on opening up registration next week or here in a couple weeks. So, if someone wants to do that, then we'll just move their registration fee over to the next season and they can come back at that time.
I got you. And then in terms of Tarek, how are you thinking about this in terms of, now people are getting into, you mentioned credits and things that you can do moving forward. But once people commit to that fall league, and let's say you open up registration in the next few weeks, people understand a little bit more about the risks that's going on more broadly. How have you navigated that and are thinking about that? And is it all different than how you did in the past?
Everything's going to change. I will say that March 12th through the 16th were the most stressful 4 days of my life, I believe. And a lot of it was I would say almost all of it was tied to this soccer league, because we had just kicked off spring season at our biggest league, which was 50 teams, on March 8th. And the way we've done our leagues is, and Jamie at LeagueApps can attest to this, and she plays in it, I mean, there is no room for error. We schedule like to the absolute maximum available dates. And we have like some backup plans if it goes wrong. If there's a snowstorm in March, you know, we might have to split the fields up a little bit differently and run 6s versus 7s, which we've done a couple times in the past. But to accommodate as many teams as we can, that's just what we've done. So it is extremely stressful when you might lose a single week for an unexpected reason. So when COVID was hitting and I was like, shit, we're going to lose a couple weeks, like my brain was exploding, because I was like, how are we going to manage like giving everybody what they paid for? That's like a big stress. Everybody, I'm in the same headspace as anyone else. I paid for this. There's no way I can see myself getting the full amount that I paid for. So now with COVID, and the possibility is Katy laying out some scenarios that, okay, a player just tests positive, they notify me, we have to bench their team. We have to then see other teams they played and consider benching them. We then have to have some policy in place where these people get compensated for it. The reality is we have to do that. What that looks like, I don't know. We could write into our terms and conditions like, COVID's crazy, it's an act of God. If you lose any games as a result of it, it's not on us. That's kind of already in our terms. But I think that will hurt our community if we don't take different precautions. So I don't like the refund concept at all. It's an extreme administrative headache. It's also, with COVID, it was, if we did refunds, then we would just go ahead and close the doors. It was just because we would have had to refund everybody, and that would have been it. So we would we'll probably have to put something new in place, or we expect that we'll put something new in place where if you miss more than one game as a result of COVID, you will get prorated credits for future seasons. And we're just going to have to do that. And it's going to be a shit show to manage that administratively. But I think that's what's fair, and that'll probably at least allow other folks to follow. And to be honest, what's interesting about the New York City soccer scene is that there are a ton of leagues in this city. And to be quite honest, I think a lot ultimately follow each other. So whoever's first out the door with some sort of policy, others will likely follow. So we like being the first out the door. We like being right out the door first, so that others ultimately just follow our lead rather than us having to follow a lead in a way that we maybe don't agree with.
Yeah, it's a great perspective. And one of the things I can share from some of the data and perspectives I see how organizations are doing this is they're bringing in the participants and the families in their organization as they develop that return to play plan. So part of it is say, here's the protocols, here's what we're doing. How does this sound? You have feedback, you have ideas, or what are you looking for? So ultimately, when you develop that, there's clear expectation that you're basically designing something that they're bought in and they're investing in. The second thing is that may or may not lend itself in the adult sector is to use the structure of payment plans or payments to address the fact that there's some fixed costs that if you incur, you can't unincur. There's some variable costs that if somehow the season got shut down because of a second wave, then you would be in a position to refund some money. So what organizations in some cases are doing is setting up a larger upfront payment to cover all fixed costs, staffing, whatever it may be. And then there may be some variable costs that are charged on a monthly basis that accounts for the fact that there may be some variation with respect to the predictability of play. So different strategies that we're seeing out there. Nate, you mentioned the idea of also adapting different forms of play, and it seems like one of the other strategies, especially if you're in an area where COVID is still prevalent, is as opposed to thinking about things in the season, you could think about things in terms of events or different kinds of approaches. So talk about the kinds of innovations that you're seeing or recommending some of the organizations you work with.
Yeah, that popped back into my head as I was listening to Tarek talk, but this is one of the ideas that's being floated around and actually executed in youth sports circles that I think has a real viable application in the adult sports scene as well. And that if you're talking about a relatively short season, 6 to 8 weeks, let's say, we're seeing organizations that are actually attempting to execute that quote unquote season as a series of individual events rather than a run-on 6 to 8 week season. There's a couple of advantages to that. Obviously, there are some disadvantages to that too, but some of those can be overcome with the technology that, you know, you can access through the LeagueApps platform. But there are some real advantages to that. First is the contact tracing advantage, in that every single week you're playing, you've encapsulated everyone who is at your field that day. And so that makes contact tracing a whole lot easier if someone were to come down or report later that they were tested positive with COVID. So there's a contact tracing advantage there as well. But there's also a business management advantage as well, in that, you know, if you are dealing with the need to refund or the need for a team to take a break, for example, you can basically set it up so that they would take that 2-week break to quarantine or whatever they need to do, and then as long as they are clear by that point, they can resume where they left off with that 3rd week out without sacrificing the entire season. So it eliminates some of the business management and logistical problems. Now, I won't pretend to know that that's a perfect solution, but it's something we're seeing a lot of organizations do to try to minimize some of the logistical challenges, especially on the youth sports side. But I think that's got a real applicable value on the adult sports side as well.
Yeah, it's a very, very good thought. Thank you for sharing
Katy,
that.
Sure. Yeah, I appreciate that, Nate. Katy, one of the questions I'm curious about is, what kind of demand did you face? Was it as usual? Was there some people that stayed away as you're getting people to sign up? And as part of that, were there specific kinds of additional waivers or ways that you all are thinking about liability or insurance as you came back?
Yeah, we are definitely down this season. We typically have about 4,000 players in our summer season. We have about 1,500. So we're definitely down. And like I said, we don't have basketball as a program right now. So that is that's not the most, but that is a big chunk of our teams. So yeah, a lot of people are taking this season off. As far as waivers, we do have a new COVID clause in there that, you know, I'm sure everyone's is the same. If you have it, it just basically states that you're aware of what's going on right now and that you could have the potential to get the virus, and you're okay with that, or you acknowledge that it is it is possible to do.
Yeah. Go ahead. So I was going to say that I think one of the things that we've seen is that, you know, the issue, it's difficult, almost impossible for organizations to get insurance to deal with the kind of COVID dynamic. But one of the best ways, and we had a lawyer on that spoke last week to this community, was talking about a lot of the best practices in making sure that, listen, if you're following the guidelines at the setup at the local and state level and you're communicating that out so people understand what they're getting into, that's the best way to protect yourself, is to develop those guidelines and follow them, because waivers really work, you know, going backwards and waiving liability claims, not necessarily going forward. But the best way to protect yourself is ultimately to follow the guidelines that Katy, you were elaborating with. Tarek, one of the things that I think is also puts a premium on is how organizations are communicating with their participants. And, you know, I was so impressed with some of the things that NYC Footy was doing, that we use them as, share them out as templates for other organizations to consider. But as it relates to how you're communicating and continue to steward that community that hasn't been able to play for a while, I'm curious how you've approached it with best practices, and also how you're thinking about the social dimension of this, because obviously I think as Nate was saying, playing is sport is just a means to really a lot of social engagement. So how do you bring that back when you're dealing with some of the distancing requirements?
Yeah, so to the first part of that, I think part of the reason I don't have much stress with NYC Footy, because it's such a passion project. It's like the greatest professional privilege, to be quite honest. But any stress I do get is on trying to send perfect emails, no question, to the community. And the best template I can recommend to anyone listening is tell the God's honest truth about absolutely everything that's going on. And that's ultimately what we default to. We told people what our financial situation was like. You know, we went that far. I mean, we just telling everybody exactly what's going through our minds, exactly what we're faced with, why, and the other, that's step one. Step two is to explain the reasoning behind every single decision we're making. And I do this because I tend to have, unfortunately, I have the personality where if I send an email to 10,000 people and one person writes back with some like negative commentary on why I made a decision, that will inform the next email to make sure that I explain in full detail why I made those decisions, so that I don't receive a single email like that. That's kind of my goal. So I listed out, I was like, this is the decision we're making. This is why we came to this decision. These are who we spoke with. These are the different scenarios we considered. And our emails are like absurdly long. I think some people that are like new to the league are like, what? I even commented in the last email. I was like, if you're new to the league, you're probably wondering why the hell I send such long emails. But that's part of it, is just honesty and explaining the decision in detail, what went into every single decision we made. And that I genuinely believe has been one of the main reasons NYC Footy has grown so fast. I'll be 100% honest. This city did not need another league, to be quite honest. I just think that we treat it very differently. We treat, the way we communicate with our players shows that we respect them so much. And do we have issues with some players? 100%. Do we kick players out because of behavior? Yes. We'll take those steps if we have to. And some players hate me, I'll be quite honest, because of taking those steps. But generally that's our approach. COVID's been tough on us because community is just so unbelievably important with NYC Footy. So many people do come out because it's a part of something more than soccer. And when you've taken that out of people's lives, I get a little nervous that people will get used to that and they might not be eager to come back because they've now had to figure out how to fill that void elsewhere somehow. So I have some nerves. We launched a free Footy fitness program where you could, we had Footy Fitness Live where you can just take Footy fitness classes, which is plyometrics and soccer skills, for free. We were chatting with kicking and screening team about actually coordinating like weekly interviews with professional soccer players and such. And we decided against it, but we decided against it just purely for bandwidth. It was just too much to manage. And so I'll say this much, Jeremy, I think we're just going to cross our fingers and hope that people come back, we go back to what we do well, and that the league can kind of grow again the way it was.
Yeah, and look, a lot of it comes down to, who you are, values you have. If you communicate consistently based on those values, you'll be successful. And if you haven't seen the communications, I think some of them are available in our Slack group. I think Footy's done a great job. Nate, maybe just give us kind of the 1 minute take on the social dimension of this. You mentioned if you learned the hard way that it wasn't just about the sport, it was about the social and communal aspect of it. How do you think about that and doubling down on that in an environment where we're actually being told to distance from each other?
Well, some of the experts on, the news channels are saying that social distancing is probably not the right word. It's physical distancing. That, the social aspect is still critically important. And I think what Tarek just said a couple minutes ago was incredible. And that's, I think, the big takeaway for everyone here: the need for transparency, the need to let people into your head, and the need to build that trust is so important, because that's what leads to building culture. And if you have a strong culture, regardless of what activity you're doing, regardless of what hardship you're facing, that community is going to stick with you. And the need for community is not going to diminish with the coming months. It's only going to intensify. And I think when things do finally start to open up, and if that's matched with a level of creativity and transparency that this moment demands, I think people are going to seize the opportunity for that engagement more than they ever have before. I think people are going to, I think the distance from it is going to make people value it more. And I think they're going to be so anxious, if they aren't already, I know I am, but I think people are going to be so anxious to return to that activity, to that sense of community. And it'll be a matter of who takes this time to invest in the product that they're putting out there to seize on that moment.
Such great perspective and advice. Katy, as someone who's opened up in organizations all around the country, navigating or thinking about that, any final word of advice for everyone out there?
Yeah, just like Nate said, everyone, people are ready to get back. We've seen, bars are opening up, and we've opened up. There's other leagues here in Kansas City, like volleyball leagues, who aren't following any protocols whatsoever. And people who are playing in those leagues and ours are like, well, why do we have to do this here? I play in two other facilities and they're not doing any of this. So my response to that was, well, we work directly with the city and we're following the protocols that we need to. So I think the people who are ready to play and who are playing are there to play. They know what they're, they know what could happen. There's a possibility that they could get coronavirus, but they're there to have a good time. So as long as you're following the protocols that you need to follow, the sanitation guidelines that you need to follow, and doing what you need to do, people don't care, which sucks because it's like, why am I doing this? I feel like I'm doing it for nothing, but they're just there to play. They're there to have a good time. So.
Well, I appreciate everyone's perspective here. I know one of the questions that got upvoted a lot also was LeagueApps' ability to support some of these ideas and technology. So one is, I encourage you to reach out to kind of your account manager and our support team, because one is we can make sure you can leverage our full tools to be able to support the kind of ongoing communications that speaks to what Tarek's talking about. And the second thing is there's all kinds of integrations too that can help support out of our platforms that may be able to support some of the questions people have. So if there's specific interest in that, we can always follow up with that with more information and based on the needs. So I want to thank this incredible panel, Katy, Tarek, and Nate. You were awesome in giving this perspective, and as well as Dr. Toresdahl. Thank you to the SSIA for also joining us and helping put together this conversation. And thank for everybody out there for really.
I'll just use this as an opportunity to thank Jeremy and the LeagueApps team. You cut out for a second there, Jeremy, so I took over. But thank you and Jamie and the broader team. You know, from someone that's cut my teeth on events over the years, you all just do such a good job with your content, and I really appreciate it. I'm sure everyone else that's listening really appreciates it as well.
Thank you. I appreciate it. Hopefully I'm back. Check out the Slack group. Thank you very much for being here and for all that you're doing to bring sports back in our communities back. Have a great day, everyone.
See ya.
Thanks, everyone.
Thanks all.